If you unfortunately get COVID-19, will it cause erectile dysfunction? What would sex be like after the infection of COVID-19? In fact, for the last 2 years, there are studies that has been focusing on sexual health after COVID-19. Naturally, if somebody who has got erectile dysfunction, for example, people who has got obesity, hypercholesterolemia, or diabetes, smokers, and also someone who's got hypertension, we all know that you're more likely to get COVID-19. One study done in University of Rome highlighted that they looked at a questionnaire on nearly 10,000 people and actually homed into 100 men of age around 30 to 40 years old. They realized that for somebody after recovering from COVID-19, the risk of erectile dysfunction is about 3 times as high. So in this study, 27% of men who had COVID or recovered from COVID actually suffer from erectile dysfunction compared to the placebo, which don't have erectile dysfunction, perhaps has other issues such as anxiety of the lockdown and so on. And they came up with this amazing campaign to say, mask up to keep it up. So this campaign was really useful in order to protect people. But what about other parameters of sexual health, such as the fertility? In fact, the study actually been published to show that men who sadly died of COVID-19, the disease underwent autopsy and microscopic analysis of spermatogenesis showed that they have significant impairment of spermatogenesis due to the systemic effect of COVID-19 infection. Men who recovered from COVID-19 also have reduction in sperm count up to 40% of the sperm production. In fact, other study which show the biopsy on a fertility-seeking help men, we realized that after the infection of COVID-19, the virus itself still exists within the parameter of spermatogenesis cells. It's all not bad news because there's one good news. There is a latest study from Journal of American Medical Association show that those people who had vaccinated with mRNA vaccines actually have no impairment of their sexual function or their fertility. So on that note, we know that you need to mask up to keep it up, or at least get the vaccine to continue to enjoy a better sexual and reproductive function. Next week, we're going to carry on with our theme of talking about sex after certain life event. And on this occasion, we're going to talk about resuming or continuing with sex after pregnancy. So if your partner is pregnant and you are keen to find out about carry on with sex during this time, then you know what to do. You have to stay tuned and you carry on putting Dr. G on the spot.